Good afternoon. Thank you, Governor Edwards, Dr. Cantor, for having me here today. I'm Dr. Kim Mukerjee. I'm a pediatrician in New Orleans, and I practice primary care pediatrics. And I'm hoping to bring a different perspective today that perhaps we haven't talked enough about, which is the impact on the daily lives of children in our state that so many of us in primary care have been seeing now for months and months on end. As Governor Edwards mentioned, I am also on our executive committee for the Louisiana chapter of the American Academy of Pediatrics. And so today I come here to speak on behalf of our nearly 750 members, on behalf of my pediatric colleagues from the state, but also, and most importantly, on behalf of children from Louisiana. There is no question that children have carried the heaviest weights of this pandemic in so many ways. Every impact we have talked about, from economic to health to education, all the different ways this pandemic has impacted families in our state, there's a child on the other side of that that has taken a direct harm in many cases. These are children who have lost caregivers, parents, grandparents. These are children whose year plus of education has been disrupted. These are children who have given up social activities and other activities that are so vital to the development and social well-being of children now for over a year. These are the children I've been seeing in my clinic and so many of my colleagues have been seeing. And while for the past many weeks we've been hearing from many hospital leaders from around our state, including our pediatric hospital leaders, we have to remember that these outcomes of a child ending up in a hospital is the exact outcome we hope to prevent. And there have been many, many healthcare providers on the other side in the community trying so very hard to prevent that exact outcome. So I come here today to speak to you as a pediatrician. I want to talk to the parents who are scared, the parents who are worried. We hear you. It is our absolute honor and privilege as pediatricians to be with you as you navigate difficult challenges and decisions with your child's health from day one. It's our honor to be there in the hospital when your children are born, to navigate those sleepless nights early on, to send your 5-year-old off to kindergarten with all of their vaccines. This is what we do. It is our job as pediatricians to ensure that children are safe, that their well-being is taken care of, and that we work with their parent and caregiver to maximize that child's potential, to thrive. That is our goal, that these children thrive. When we have a pediatric death in our hospitals, when we have children admitted for a preventable illness, we've failed our children. But it's more than that. When our children are falling behind in their education, when our toddlers are unable to reach their developmental milestones and are falling behind, in fact, because they can't access really key early interventions, we've failed. When we can't provide food and nutrition and medication for our children, we have to ask ourselves, what can we do better? How can we ensure that these children are safe? As your child's pediatricians, we will tell you that there are many things you do day in and day out to keep your child safe. From buckling up your baby and toddler in a car seat, to putting on a bike helmet when your child goes off for a bike ride. These are tools that keep your child safe. It is our honor to help you navigate these discussions of how to best keep your child safe. And now we have new tools at our hand. We have masks, we have vaccines, and we must look at these as essential tools in our toolkit to keep our children safe. This week, our Academy chapter of American Academy of Pediatrics here in Louisiana sent a letter to Governor Edwards and his team supporting the mask mandate for children in schools. We know that children thrive when they are in school, and we must prioritize that they have this opportunity to be in school, to learn, to grow, to develop, to maximize their social skills, their educational achievements. But we have to ensure their safety. And one of the most important ways we do this is through universal masking in our schools. It's a multi-layered approach. Masks are an important prong. We have vaccines, social distancing, good hand washing. All of these factors must be incorporated. But now is not the time to be asking, what should we take away from our children? Now is the time to be asking, how can we keep them safe? And I urge every adult, every parent, everyone who has loved a child, knows a child, every single person in our state to center this conversation around the safety of children. When a child is safe, they remain healthy. When a child is safe, their well-being is maximized. And all of our discussions must center around how to keep children safe. Now is not the time to politicize things that we know are excellent measures to mitigate the impact of a preventable illness on children. Our Louisiana chapter of the American Academy of Pediatrics stands firmly with the American Academy of Pediatrics that children must be in school and kept safe to prioritize in-person learning. One death is too many. One child who falls behind is too many. Another parent coming to my clinic who has run out of formula for their baby is not acceptable. Another adolescent coming to my clinic with a mental health crisis is not acceptable. We have to do better by our children. And we do this by centering their safety and their well-being at the middle of every discussion we have. And so as a pediatrician, I remind you that we are here for you. We are here to have these discussions. We understand you may have questions. That's okay. Just like every other decision you have had to make for the health of your child, we want to navigate these questions with you. We want your 12 and above adolescents vaccinated, and we want to start having conversations with you to answer your questions about your younger children so that we are ready to vaccinate our 5 to 11-year-olds when that vaccine is available. I urge you to remove the politics, to remove the arguments from this discussion, because no one in this room or in this community or in this state would argue that the life of a child should be anything other than prioritized and that that child should be safe and thrive in their childhood. And we as pediatricians are here to help ensure that that happens. Thank you very much. Happy to answer any questions. Yes.
Thanks for being here, Doctor. Can you talk a bit about when it comes to how the virus is impacting children, sort of what is known and what is unknown at this point about, is it more, is it that more children are getting it because, there's more interactions? Is it more virulent in children? Can you talk about how it's impacting children?
Sure. So what we know right now is that we are dealing with a completely different animal than what we saw last year. This Delta variant is highly transmissible in kids. We know kids are getting sick. We are seeing a high positivity rate in our clinics. This is unprecedented numbers of children in our hospital system sick with COVID, including in the ICU. And so what we know about COVID is that it absolutely impacts children and that we are seeing higher rates of it currently than we have ever seen before. We also know from a year now plus into this pandemic that the impact of COVID on children is much more than the disease burden itself. And therefore, we have a really large responsibility here to really mitigate that disease burden so we can also mitigate the impact that COVID has on children in all of these other factors. Thank you.